Okay, here we go. This is NSCA Essentials of Personal Training, Chapter 9. This is specific to client consultation. Now we're getting into presentation 2, and this is more about pre-participation and health appraisal screening. What you'd like to have is you have the initial conversation that somebody wants to work with you. That individual fills out a health history questionnaire, fills out some kind of documentation that allows you to have a pre-participation evaluation of their readiness, their ability to actually participate in a physical fitness program. And these forms, some are very simple, some are more complex, but they serve several purposes. We're looking to identify known diseases and risk factors associated with cardiovascular disease. We're trying to evaluate lifestyle factors. And we're also trying to identify those who might need medical referral. I would also state that the documentation we're talking about, these questionnaires, they allow you to have the opportunity to interact with your clients and have a conversation with them and an informed conversation with that person to be able to kind of build that relationship as you're finding out more about them. So the PAR-Q is one. The additional screening is, physical activity readiness questionnaire is a PAR-Q, if I may just clarify that. And then beyond that, we look at additional screening tools and then record keeping. So for this presentation, when we talk about the PAR-Q is a pretty straightforward, simple document that individuals might fill out. And the idea is it's very binary, yes or no questions. And the person either answers yes or no. And if they answer no all the way down the document, they're pretty much good to go to work out. If they have yeses, then you may need to move on to and evaluate those yes responses a little bit deeper and perhaps even send them on a referral to their doctor. Health histories are a little more involved, usually multi-page questionnaires that actually have more, if you will, in-depth questions and require greater in-depth answers, as we'll see. With the PAR-Q, short tool, it's basically based upon recall of the client. And it's kind of like the first or basic step that most facilities will use to determine readiness. It's an okay tool. It's one that's been around forever. And you got to understand that, the PAR-Q itself, you can find this on page 163 here. The PAR-Q itself is or are symptoms that are experienced by the client and confirmation of different diagnoses by a physician. Now, a health history questionnaire, I get myself in the middle here. When you look at that, it's a little bit more thorough, and it's used to identify these different risk factors for cardiovascular disease and other contraindications to exercise. Contraindications meaning reasons not to exercise. And it helps also to evaluate some medications, perhaps supplements, or maybe lifestyle deficiencies that you would see in a client. So the idea is it's a multi-page form that asks numerous questions, and you can kind of, as you go through the process and look on page 167, you can kind of read through and get an idea of the different sections and what we're looking for when we have that conversation and dialogue with our clients. A person had a hip replacement 4 years ago. There's an orthopedic concern. They had a surgery to replace that hip. Well, that's an operation that happened 4 years ago. It's not recent, but it's something you can speak to. Perhaps you have medications where they might be in a beta blocker or other things. Those are the kind of questions that come about as a result of the health history questionnaire. And you as a trainer have to be skilled enough to use that as a tool to facilitate the conversation. Now with lifestyle screening, you have, in terms of the lifestyle questionnaires themselves, they can vary from facility to facility, and it just depends upon what the facility is looking for, looking to use as a tool. And it's basically used to help, evaluate the person's day-to-day activities. Perhaps it's something like dietary intake here, or it's another tool where you evaluate levels of stress or physical activity. So there's different tools that you can use to kind of get a clearer picture regarding the person. Informed consent is definitely a document that you'll have in terms of working with clients. The part that's important about informed consent is speaking to and providing the client the opportunity to consent to the work they're about ready to do, the workouts they're about ready to do. But the other side of that equation is you have to be very transparent on the front end and have a detailed description of what the program is going to be and what those risks may be. And usually when you look at contracts for fitness facilities, it's written like catastrophic. A person can work out and they can suffer the consequences of working out up to and including death. And it's kind of daunting when you read through some of these, but they have to be written in that way to have this blanket coverage have a blanket coverage over the different areas of possible risk that might be in the facility. With assumption of risk, as I mentioned before, clients, just by the fact that they're in a fitness facility, have taken on a assumption or presumption of risk. They understand that risk is there. And usually these documents, if you will, are not even documents. They're like a sub-paragraph within the contract when they sign on for a membership or they sign on for personal training. But they have, what happens is the person or the client waives their legal right to any kind of damages that might happen if they are in fact injured. Now, again, you always want to protect yourself with insurance, but understand that when the person signs an assumption of risk or a waiver of liability, what they're essentially saying is, yes, I understand there's risk involved, and yes, I understand I might be injured in doing this. Now, the difference is, I'll just stress this, they put, even when such injury arises because of provider negligence, I would contest that the presence of negligence, whether it's facility negligence and they've not actually managed their facility and kept equipment up to date and maintenance equipment, or it's practitioner negligence where they don't keep up with a standard or practice appropriate for the person or the industry, that differential, that presents negligence. So you have a standard of care that's expected, and if you don't operate to that presumed standard of care in the industry, you are negligent in your duties. Pre-participation of documents for children. Many times, children will be, because their guardian might be part of the facility, the children are part of the kids club or the children do programming. And because the children are minors, the parents are the ones signing off on the children. So the issue you have is, when you're working with children, is you might be working with the child, but you have to speak to the parent and you have to be able to articulate to the parent what's going on with the child and be able to work with that child. Now, on any given day, that child might be going through a growth spurt and have aches and pains and injuries that are unbeknownst to you, and you take them through a workout and might exacerbate an issue, but the child is just not competent, respectfully, to be able to really explain to you, hey, I injured my knee today playing kickball at school or whatever it may be, and the parents look to you regarding an injury. So it takes good communication between you and the parents to make sure you're all on the same page. I will say this, I've worked with many, many children. I've worked with them speed, agility, quickness. I've worked with them in generalized fitness, and I've had good results. And I don't think I've had too many issues regarding, children getting injured per se. So part of this is understanding you need to have the right programming in place so you don't injure the child. With record keeping. Now, a person's going to give you a health history questionnaire with a bunch of medical information on it that also includes medications that they're taking. This is sensitive information that is part of the Health Insurance Portability and Accountability Act, HIPAA. Now, you might not be in a medically based facility, but because you've received this information, there's a certain amount of protection you have to have in place. For me, if I get a written document from a client and we've gone through the health history questionnaire, I'll oftentimes just give it back to the person. What I've seen in fitness facilities is they'll have manila folders in a file cabinet that's unsecured, and they have the health history questionnaire for every person that's doing personal training. Or even the staff itself doesn't receive any kind of continuing education or training regarding HIPAA regulations and being able to understand even what that privacy is or the requirements are for privacy regarding healthcare. So even though it's quirky where you're not in a healthcare facility, you're not an actual doctor's office, because you're receiving that information, health information from your client, you're held to a certain standard. And if you don't actually at least meet those set of standards and protect the information, sensitive information that's being provided by your client, you would be negligent, if I can use a term from the slide back, you would be negligent in your duties. So to a certain degree, you have to be very familiar with how a facility might manage health history questionnaires and what would be their best practices and follow their best practices. If their stance is, well, we just give them to the trainer and they can do what they want with them, I would probably give it back to the client when I'm done, or I would shred it rather quickly, just so I don't have that on my person. So the scope of practice for the personal trainer is kind of important. And it's what you do. You're not a doctor, you're not a dietitian, unless you have some specialties and some other degrees. But the scope of practice of the personal trainer involves the responsibility to interview potential clients, gather and assess pertinent information about their personal health, medical conditions, and lifestyle to meet their individual health and fitness objectives safely and objective. I would also say, based on what we talked about, that the scope of practice of the personal trainer also involves an understanding of risk management and environments of risk and how to mitigate risk for the client to the best interest of the client. So with that, guys, I'm going to break off from this one and go to the next presentation.